Typically, you would be right here in Studio B with both Courtney and me, but these days, I think it's so great you're able to continue doing what you're doing by doing telemedicine and seeing people, and I'm guessing a lot of people are holding up very dry, irritated, sort of itchy red hands.
They are, and that's the great thing about what we do in dermatology is it's one of the few areas of medicine where you can actually show me what's wrong and I can actually help you via telemedicine just through your smartphone or the computer screen, and I can actually do that now in a way and show you what we as dermatologists recommend during these times, because I know so many of us, especially someone like you, Courtney, who's prone to a little hand eczema, it's really flaring. And then for the average person, you're doing the right thing. You're staying home, you're staying smart, you're washing your hands 20, 30 times a day, but we don't always necessarily moisturize. So I want to address the best way to do that after you wash.
And when do we get started? Because we're constantly washing our hands and using those sanitizers. So do we moisturize right away after every wash?
That's a great question, Courtney. So what you want to do is wash your hands. You know, you can do the 20-second happy birthday, soap and water, not hot water. You know, lukewarm water is fine, soap and water is fine, and actually hand sanitizer is fine. But if you do soap and water, which is the most effective, you want to pat dry with a towel. Don't scrub dry, because that further basically irritates the barrier of the skin. Pat dry and then immediately apply a very lipid-rich cream. So I recommend creams. You want to use something like CeraVe cream, which is a very heavy lipid-laden cream, because remember, every time you wash your hands with soap and water, you're washing off all of those really important barrier items our skin has: lipids, cholesterol, ceramides. These creams now have it. I like CeraVe. I also like this Lipicar from La Roche-Posay because it's in a pump. You want to use something ideally in a pump or a tube. I do sometimes at home find myself grabbing a jar when I'm at home, so I'll grab my jar of CeraVe, I'll wash my hands with soap and water, and I'll immediately, 20, 30 times a day, put this on my hands. So what you're going to do is take a nice big scoop, put it on your hands. Don't forget the tops of your hands. People with hand-washing dermatitis are especially prone to dermatitis across the knuckles. They'll get splitting, fissuring, cracking, even bleeding, and on the fingertips. So you may have felt this. You can literally do this every time you wash your hands, with a caveat, which is if you're at home and you're caretaking for someone, make sure if you're using a jar of cream like CeraVe, write your name on it in a marker so other people aren't putting their hands in your jar. And during these times, I really prefer people, and you can order it off of Instacart, you can have it delivered, get a pump, get La Roche-Posay Aveeno Eczema Therapy. All of these products come in a cream form and a pump, and that way you kind of keep your hands out of the cookie jar.
That's a great tip. That CeraVe is great too. I get mine at Target. It's inexpensive. It works so well. All right, let's talk about labels and things that we should avoid, and also things we should look for. I understand, Dr. Ingraham, that as much as we all love those scented soaps, fragrance can actually exacerbate an already bad situation?
Absolutely. I was chasing my children around the house, taking away their apple-scented hand sanitizers, because those things really, the fragrances are known allergens and irritants. You want things that are bland, fragrance-free. You really want to look for products that are designed for eczema-prone skin. Even though you may not by definition have eczema, you are developing hand eczema from washing. So I like Aveeno Eczema Therapy. It actually says eczema therapy on it. And these products are designed for people with sensitive skin who you're avoiding fragrance, you're avoiding retinoids, anything anti-aging and fun right now you want to avoid. You're not trying to anti-age your hands with glycolic acid, sal acid, any products that contain acids, retinoids, fragrance, stay away from them. Your hands aren't going to age during this time, but they will become more irritated if you use anything with scrubbing, gritty exfoliation. It's all about being gentle. And I love that Gloria Gaynor I Will Survive video that went viral, where she shows people how to wash their hands. And we almost need to show people the same way how to cream their hands after each wash, because what I tell patients often, not during these times, but especially during these times, I want to say, every time you wash your hands, you're stripping away that barrier. And if you get to the point that your hands are raw and cut and fissured, microbes, bacteria, viruses can get into your skin, which is really counterproductive, right? So you want to be able to wash your hands. And then
Absolutely.
Derek, further point, and Courtney, is if you're like me and you're wiping down your clinic between patients or wiping down your house or caring for a loved one, put on gloves. You can use a kitchen glove. I'm going to put on a glove right now. But if I was going to go and wipe down my house with one of those great Clorox wipes or any kind of antibacterial wipe, put on a glove first, because those wipes are very, very strong and they can really irritate your hand, especially if you've already overwashed your hands.
Oh, that is great advice. The other thing that you mentioned, the cracked knuckles, that happens to me, and I tend to irritate that. I dry my hands thoroughly. So is there anything that we can put over those in between the knuckles? Would you recommend sort of like a jelly almost, like a salve to put over that?
Vaseline is your best friend. Vaseline or Aquaphor, a tube of plain old-fashioned Vaseline. If you can put that on your knuckles, not Neosporin, not polysporin. Some people will generate allergies to these. Unless you have a sign of infection, you don't need to use petrol. Just use plain old-fashioned Vaseline or Aquaphor across the knuckles. And then, Courtney, you bring up a great point. If you have any old gloves, cotton gloves laying around the house, or you can order these online on Amazon, get some white cotton, inexpensive gloves at bed at night. Go to sleep with the white cotton gloves on with the Vaseline on your hands. It really helps to reinstate that lipid barrier. And then if you're especially prone to chapped skin, you can put a humidifier on in your bedroom and sleep with the humidifier on. Now, luckily in Houston, it's nice and humid now, so we probably don't need this. But in other parts of the country where it's still cold and dry, even putting a humidifier on at night, some Vaseline on the hands will add that extra benefit.
Dr. Sherry Ingraham, it's great to see you. Great tips as always. Thank you for your time. And a reminder to our viewers, if you would like to connect with Dr. Ingraham, just look for the Scene on Houston Life section of our website. We'll be right back.